Sacred Heart is proud to sponsor Pensacola Histories in recognition of the Daughters of Charity who brought their mission of care to Pensacola over 90 years ago.
Hello and welcome to our continuing story of Pensacola, North America's first place city. In our recent episodes, we've been talking about the evolution of healthcare delivery here, and we began our story, of course, way back in early Spanish and then British times, primitive healthcare in the maritime hospitals. We brought our story forward with the beginning of the Navy Hospital, our first real hospital here, and then carried forth the story through the 19th century with the evolution of new ideas in medicine, the several proprietary hospitals that were here through the 19th century, including St. Anthony's, which was our first real hospital. And then, of course, the evolution to Sacred Heart Hospital in 1915, and then forward through the 1920s and 30s. We brought our story in our last episode to the point where Sacred Heart Hospital was doing well, even though we had fought our way through a difficult depression when money was very scarce. Now, as we start today, we also want to bring up another part of the healthcare equation here. It was in the late 1920s that the state established here in Pensacola one of several tuberculosis sanitariums that they put about across the state. TB was a very serious problem in those days, and as a result of that, a sanitarium was established out on West Leonard Street, and it continued to serve in that way up into the 1940s. Now, by that time, of course, into wartime, the science of medicine had developed, first of all, these sulfur drugs and then penicillin. So medical authorities began to feel that tuberculosis was under control, and the state was about to consolidate or even close some of its hospitals. And at this point, a Pensacola physician named Dr. Sidney Kennedy went to the state and said, look, we need something else here in Pensacola. Our population is growing. We would like to take that tuberculosis hospital and convert it to a general hospital. And so that was done with the blessing of the Escambia County Medical Society, and this was when Escambia General Hospital was born. In that same decade, work proceeded on two other very small hospitals, one of which became known as the Maternity Hospital. It was on East Mallory Street, very close to what would become the headquarters for the Medical Center Clinic a little later on, and then also on the south side of town, St. Joseph's Catholic Church developed a clinic there which became known as Our Lady of Angels. It was a maternity hospital for minority mothers. So all of these things were taking place as the 40s proceeded. And through that decade, even with war in progress, there was another group that felt that we still needed something more. Pensacola, Escambia County were growing. And so at this point in time, a group from the First Baptist Church, led by Earl Gaston, E. Dixie Beggs, and a number of others like Sim Davis, they came together and began to plan a new Baptist hospital. Now, it took them more than 8 years to get all of the funding in place, and this was finalized by Pensacola and Baptist Hospital getting the first major grant that was put forth from federal funds called the Hill-Burton money. And with that in hand, ground was broken for the Baptist Hospital in December of 1949, and the hospital was completed about 2 years later in October of 1951. Now, Baptist Hospital was 110 beds. It was ultra-modern for its time. It had modern x-ray equipment, it had modern laboratory equipment, and it was well-equipped both with nursing staff and others. And I think we ought to stop just a moment here to recognize a little bit about healthcare economics at this point in time. In 1951, when Baptist opened, there were about 50 physicians, counting all through Escambia County. And that included the doctors Turberville up in Century, and those, of course, who were practicing here. All of these, some of these, were now concentrated in what was relatively new Medical Center Clinic, which had opened in 1938. Now, Baptist Hospital was ultra new, and of course, they concentrated very heavily under the administrator, Pat Groner, on quality care and also on cost control. And I can give you a few little ideas of what it was like to have medical care in those days. As we look at things in the 21st century with the healthcare costs burgeoning, it's important for us to look back about 60 years and get an idea what things were like. First of all, when Baptist opened, about half of their rooms were two-bed semi-private rooms, and a daily charge for a bed in a semi-private room then was $8.50. At that point in time, the nursing staff, very well qualified staff, these people worked a 6-day week, and the average salary for these ladies was $80 per month. There were no benefits, no health care, no life insurance, nothing like that, $80 per month. At this time, very few people had health care insurance. A typical case, there were a few, but a typical case was what was given at the Armstrong Cork Company plant locally. And here, an insured party, an insured employee there would have himself or herself, their wife, and children, and that total package for the employee's charge per month was $2.75. So you can get an idea how things had changed. A typical medical visit, a visit to a physician's office, was charged for that was about $2 on the average. So that was basically the way things looked at that point in time. Well, the medical care, of course, began to burgeon with the arrival of Baptist Hospital, and we began to see more and more physicians arriving in Escambia County. Many of these, of course, were former medical students, and who saw this as an area of opportunity. And of course, even beyond that, of course, the GI Bill was encouraging the study of medicine. So by the time we reached 1960, the numbers of physicians practicing here had grown by almost 25% and continued to grow. Now, at the same time as all of that happened, there was a demand for more nurses. And we remember that the Sacred Heart Hospital and its nursing school, which had begun shortly after the hospital opened in 1915-16, that had been the sole source of nurses locally. Now, in the latter part of the 1950s, Baptist Hospital teamed up with Pensacola Junior College and established a new 2-year study nursing program. And this quickly began to supply many of the nurses that were needed locally, so much so that about 7 years later, Sacred Heart felt that the private sector was taking, or that rather the public sector was taking care of the training process, and so Sacred Heart closed their School of Nursing. Well, as we move forward into the 1960s, a couple of other things begin to happen to us. First of all, the Escambia General Hospital out on the west side was old. It was rendering its services, and it was considered the public hospital where a lot of the medically indigent patients went. And by the time we get into the late 1950s, the Medical Society and others were turning this process over in their minds and saying, look, this hospital is way out of date. The rooms are out of date. The methods are out of date. We need a new hospital. And so in 1957-58, the county commissioners agreed to stage a referendum, a public vote, to determine if funds would be made available through a bond issue to build a new hospital, and the public did support this by a ratio of about 6-4. And so beginning in 1960, with Raymond Dyson as the contractor, a new, very lovely 4-story Escambia General Hospital was erected on West Leonard Street and went into service about that time. Well, at this point, we move ahead just a little bit, because with the new hospital, we have an enlargement of public clinics. Now, of course, many of the hospitals locally here were becoming concerned, all of the hospitals were concerned about the fact that there was an increasing number of people who needed help, who just didn't have the financial resources, and of course, very few of them then had health insurance. So in the late 50s and 60s, we began to see a proliferation of clinics, all of them associated with the Escambia General Hospital. And these were supported by the Alliance Club and site services, by the Kiwanis Club. Other civic clubs became involved. And then at the same time, in early 1960-61, all of the hospitals combined on a new service. They underwrote a intern resident training program here, which they called PEP, the Pensacola Educational Program, and into this a great number of very qualified young people came who were either interns or residents, and of course, as part of their service and training, they cared for or helped to care for medically indigent patients, and the plan worked extremely well, particularly centered for the indigent care at Escambia General. Well, we come to 1964-65, and something new comes on the scene, not just locally, but nationally. And for this, historically, we have to turn back the clock a little bit to 1949. In 1949, the man who was then our president, Harry Truman, began to espouse the idea of a national health care program. He and Florida Senator Claude Pepper were the real proponents of this. They put it before, there was a great public clamor of this. Nationally, the medical societies were against it, and the idea died, to be revived slightly once or twice after that, but then to come to the fore again in 1964-65 under President Lyndon Johnson, who said that the time had come, and Johnson had the clout and the votes, and we then introduced two programs. One, Medicare, which of course was to provide health care coverage for persons who were retired or seniors, and then a Medicaid program to help with the medically indigent. And these, of course, these programs were adapted to service in each of the 50 states. All right, Medicare and Medicaid were a new idea. And as both of them were being debated, the National Hospital Association and the National Medical people went to the Congress and said, all right, it looks like you're going to pass it, but please don't do it in its present form, because basically the way the plan is written, it's a cost-plus arrangement for the health care providers. If you do this, it's like giving some people almost like a license to steal. And they, of course, did the Congress listen? No, they didn't. They went ahead and passed it. Well, the programs were introduced, and they were immediately very popular, and of course the Hospital Association and the medical societies were right, because the cost of care began to mushroom just rapidly as this passed on. Now, there was another point here locally that began to be affected by all of this. First of all, over the years from 1950 into the mid-60s, the administrators of Baptist and Sacred Heart Hospital had cooperated beautifully on doing things to help control costs and prices. For example, they tried to make sure that they didn't duplicate services where expensive equipment or expensive service was involved. And it worked beautifully. Their cost of operation and subsequently the price charged for care remained low. Well, with the coming of the Medicare and Medicaid, this began to be unraveled just a little bit, and then something else happened which was just explosive, and I don't think anyone could have forecast. We were right now in the mid-60s, right at the time when the program to put a man on the moon was moving forward very rapidly. And a lot of that technology was transferable into equipment that would be used for diagnosing and treating illnesses. The first of this equipment came out of Great Britain. It was called the CAT scan. And of course, this was a magic new tool. And almost every year thereafter, some additions to that or new equipment of similar character came along. Now, each one of these was extremely good, but also very expensive. Now, as a comparison, when the Baptist Hospital opened in 1951, the total cost of buying the property, building the building, and equipping it was about $1,100,000. When we come into the purchase of this new technology, almost every one of the devices we're talking about would cost about that same amount of money. So you can see if the hospital puts that in place, that has that additional cost factor in its pricing. And then, of course, to operate such equipment, you didn't have minimum wage people doing that. You had to have someone with very, very special equipment, very special training, and these people did not come inexpensively. So as these new higher priced people moved into the equation of overall employment, there was a pressure to raise the salaries of all of the others in the hospitals. And so a situation which had existed forever, wherein people who served in hospitals felt that this was a sort of a compassionate calling and were willing to accept lower salaries. Well, now this began to change, so that by the time we reached the late 1960s, we see the cost elements within hospitals and other parts of healthcare as well beginning to rise. And with that rising, of course, came an escalation in what you paid for the service. So step by step, this began to happen. And so by the time we reached about the late 1960s, we begin to see all sorts of new things happening in healthcare overall, and we'll return to that with our next episode.